Hello everyone, welcome to today's topic concerning depression in Uganda. So depression, like we said before, it's one of the commonest mental illnesses which is first in Uganda and can occur to anyone. It can be me, it can be you, your brother, your relative, anybody is liable to getting depression. And by prevalence, 1 in 3 people in Uganda are expected to suffer from depression within their lifetime. This shows that depression is highly prevalent in Uganda, with a percentage of more than 25 to 30% in populations within Uganda. However, it's noted that depression is higher in certain groups of people than other groups of people. For example, it's noted that depression is higher in people who have been affected by some stressful events. For example, within the Cambodia region, people who were affected by Kony, rebels, and the other insurgencies tend to have a higher prevalence of depression than regions like in eastern Uganda. Also, it's noted depression to be higher in border regions. For example, Congo, whereby refugees always come in Uganda from the nearby countries into Uganda. Such individuals tend to be more depressed due to the political instabilities in their regions. And also, it's noted that depression occurs in both men and women. However, the difference between men and women is one. Women tend to get depression highly. They tend to get higher cases of depression. And the good thing with women is one, they normally seek medical support from health facilities as soon as possible than the men. For example, if a woman spends 2 weeks not eating food, if a woman lacks sleep for 2 weeks, if a woman loses interest in performing her daily chores, for example, cooking, everyone will get attentive or everyone will take caution, and immediately the woman or the wife will be taken to hospital for mental health treatment and she will be fine. However, for the men, when they get depressed, they rarely visit health facilities except if the condition worsens. And before the condition worsens, the men tend to opt to other activities, for example, excessive alcohol abuse, excessive drug abuse, indulging in activities, for example, sports, clubbing in clubs, looking for peers in order to hide themselves in their depression. But however, for the women, they visit earlier. And for that case, it's not that by the time a man comes in hospital when he's depressed, it means that person is severely depressed. Therefore, we as health workers, we as family members, we as community people should be able to identify signs and symptoms of depression within ourselves, and number 2, within our relatives, within our friends, and within the community people. And in case you identify the signs and symptoms of depression, then take that individual to the nearest health facility for mental health support and treatment. Remember, if we don't manage depression, then it can, in the early stages, it can progress from mild depression to moderate depression and to severe depression. And in cases of severe depression, you might find an individual threatening to commit suicide or completing suicide, or you find a person killing other people just because he is depressed. Therefore, identify depression as soon as possible and save a life. For details concerning the signs and symptoms of depression, watch our next video. Thank you.